Coming up, we'll be on location at Make It Possible LLC in Waldorf, Maryland, discussing advances in mental health treatment and how they can effectively address psychological, emotional, and behavioral needs and improve your mental health and wellness with one of this region's top psychologists and mental health doctors, Dr. Amarilys Galloza Carrero. Welcome, Dr. Galloza Carrero. It's a pleasure having you on our program today.
Thank you for having me, and you can call me Dr. G.
All right, well, Dr. G it is. It's your first time, in fact, on our program. We have a lot to talk about, and I wanted to begin by letting all of you out there know that Dr. G and her practice, Make It Possible LLC here in the Waldorf, Maryland region, you certainly are recognized as a top mental health doctor throughout the DMV region, for that matter. You have established a reputation for excellence in mental health treatment and patient care as well. And I wanted to begin by having you please tell us about the vision for your practice that really helps separate and sets apart your practice apart from many of the others. Beyond the fact that you not only speak fluent English, but also Spanish and sign language as well.
The vision of my practice is to be able to provide mental health services that are excellence to individuals that often experience language barriers, such as the Latino community or the deaf community.
Yes.
And I think that what set us apart is that we recognize that each individual has cultural values and beliefs, and that we take all those components from a place of respect and develop a tailored treatment for each person. Because at the end of the day, we want to be able to offer top tier and kind of like merge that with cultural sensitive approach that will give what I think is the most important thing to these communities and to everyone, the hope a person needs to see he or her future in a more positive outlook.
Hence the name of your practice, you make it possible.
To make it possible
right?
for them.
Yes.
To be successful.
Absolutely, in all different aspects and stages and phases of life, depending on what the help is needed. That's where you come in to help guide them and overcome the obstacles and challenges they may be facing. Mm-hmm. I also wanted to ask you, Dr. G, what are some of the more common mental health issues that you encounter and treat at your practice?
Well, at this point in my practice, we are concentrating in psychological assessments. And in that regard, we see in different types of mental health issues that require to be diagnosed. Other type of services that we offer allow us to encounter individuals that are experiencing anxiety, depression, post-traumatic stress disorder. And even though there's not a formal diagnosis for what we will call anger issues, through our anger management services, we do work with individuals that experience different difficulties when it comes to managing their anger in a healthy manner.
What can cause some of these conditions or issues to occur, Dr. G? And I know that depends on each person, but generally or typically speaking.
The causes of a mental health issue are multidimensional and very broad. At this point in the discipline, we are in an accordance that is a combination of a biological, psychological, and social aspects in a person's life. And to illustrate that a little bit better, right, we could use, for example, post-traumatic stress disorder, okay? So if we think about post-traumatic stress disorder, then the psychological issues there could be a cognitive issue. You are an individual that might see things in a negative light. So that puts you at more propensity to probably, when a traumatic events happen, to develop PTSD. Or if you don't have coping strategies at that moment. That could be another issue. When it comes to biological aspects, we can see neurological imbalances because anxiety creates these issues in our chemistry. Or, according to new research, some individuals might have some genetic predisposition to develop post-traumatic stress disorder. But in a way, more importantly, from my view, there is the social aspect. Traumatic event has to occur, and which could be you got into a different situation, a war zone, something happened. You didn't have social support in that moment, and that might actually put you at risk. However, what I have learned in my years of experience is that trauma is something that can happen to anyone, and it will stop your life right there and then. And then things keep moving on and you're just stuck. And no one can help you at that moment. It's like a car accident, You can be driving perfectly and someone just hit you, and all of a sudden you're dealing with a lot in your hand. What can we do is provide you the support you need to get out of the wreck.
Yes.
And there are other situations like substance use where it's kind of like the tip of the iceberg situation. A person believes that they cannot cope with a situation, so I'm going to use something and I have control over everything, which is really far from the truth. And then at some point, the substance takes over and you don't know what you're going to do. And in that instance, it actually requires a mental health professional that can actually identify what is really happening that is creating the substance use problem, what is underneath, truthfully.
Yes, absolutely. I also wanted to ask you, Dr. G, for the folks watching, what is the evaluation process that you utilize at your practice for diagnosing a patient's specific issue or issues that they may be dealing with, and then obviously customizing the appropriate treatment plan to help that particular individual?
As a clinical psychologist, I have several tools that I can use to provide diagnosis in an individual. And usually what is the most common tool in a sense is to conduct a psychological assessment. But what is a psychological assessment? A psychological assessment is a tool that it has empirical measures that you do observations and do clinical interviews to kind of gather the information that is necessary to determine what is the situation at hand. Now, in this case, we let our evaluation to be guided by what we call the referral question. The referral question is what the person wants to know. They come here and they ask, okay, I have this question. And it's sort of like when a person broke their leg and they go to the doctor and they say, well, I don't know if my leg is broken. The doctor is not going to do a blood test. They don't care if they have high cholesterol. They just want to know if the leg is broken or not. Exactly. So they do an x-ray. For us, it's kind of similar. You tell us, does my child has ADHD? And if that's the question, then we put together what we call a battery of tests together to answer your question, develop a report, and what I think most importantly, give you recommendations. Because what is the purpose of knowing a diagnosis? If you don't know what to do with that, how this is going to help you. So we want to provide recommendations that can give a person kind of like a direction of what they can do with the situation that they have at hand.
So it's very thorough intake, evaluation process, and then it helps you and your patient with you leading them on this to guide them on the right and create the right roadmap towards their recovery.
Yeah, and I think it orients treatment intervention it can orient schools to address, for example, if it's a kid, help schools to determine what accommodation that person might need.
Yeah.
It gives the individual, again, a chance to, in the middle of that situation, be the best person they can. How much adjustment we need to give.
You make it possible for them.
We are trying to make it possible for them.
Yes, indeed.
Because they do have potential at the end.
Is there a typical candidate that can develop these mental health issues that you've been talking about, Dr. G, that may have more of a propensity to get or have some of these issues?
A mental health issue is something that can happen to anyone. So there's not a typical person, okay? Nonetheless, this is not necessarily a stigma. This is just a challenge that you need to address in a different way. And at times, you might start experiencing mental health symptoms, and you don't address them, and they get to a point that they become so distressing that you require additional support. Saying that, right, it is important to consider that, as you were saying, there are some factors that might impact the likelihood that you will develop that. Genetic factors, maybe you have a family member that experienced anxiety or depression, and that could impact your upbringing. Or, again, social support. The support that you have is not great, and that can also create some difficulties. I also think that it's important to mention that there are protective factors too. That if you have support, if you are able to recognize when things are not going the way you want, and if you're also able to look at things and think, this is getting too much. I need to find a mental health provider before things get out of hand.
Yes.
And I think those type of protective factors can prevent a lot of heartache.
I also wanted to ask you, Dr. G, what would you say are some of the most effective strategies or therapies available to help your patients address some of these issues?
There are many effective strategies and therapeutic approaches nowadays. And I think it's important to consider that now the discipline of psychology is moving towards the evidence-based interventions. And these evidence-based interventions are interventions that have been proven to be effective, meaning we have done this several times and they worked. They are applicable. We can use it in any different setting, and again, they do work. And they also go to constant scrutiny just to make sure that they maintain their effectivity. So in that way, these type of interventions are kind of ideal when it comes to using them for mental health issues. Some of those interventions that are evidence-based are cognitive behavioral therapy, are dialectic behavioral interventions. And even at the end of the day, even if you're using those interventions, it's more about the individual that you have in front of you too. What is the problem or the challenge that person is encountering, and what approach might actually be the best fit for this individual? Because research has told us that it is actually, in a way, the therapeutic relationship, that way that you can connect to people, that makes so much impact in therapy. And also how much that person can progress in a session as well.
Absolutely. And you utilize an integrative and holistic approach at your practice. You really look at your patients from a whole perspective, if I may use that word.
Yes.
And I would imagine that based on what you just said and the different tools, again, that you have available at your disposal with your years of experience as a leading psychologist in this region, you really customize the appropriate treatment plan and integrate different therapies, I would imagine, to help each of your different patients achieve their goals.
Yes, and I think in this way is using evidence-based interventions and at the same time taking into consideration the cultural perspective. So when we are applying this, and this is where our clinical judgment comes into play, that what we are actually doing with that person in therapy is something that is going to be effective and that is going to support the individual because that person is suffering in a way.
Generally speaking, what type of results do your patients see through their therapies and their sessions with you?
I am truly glad that you asked that question because I think that is the heart of my practice. And I will say that the results are transformational in a way. And I think that is precisely why that's the name of my practice. Make it possible unlocking your unique potential. We want to provide people the hope they need and to recognize that even in difficult situations, if you come and work with us, we will give you the support you need to overcome what is happening and maybe become the person that you were meant to be. Even if other people have told you that you don't have potential, or even if they have told you that someone, you know, maybe a kid with a disability, don't have potential, we do recognize that everyone has potential, and it's actually a matter of unlocking, just getting it out, the potential that person truly have.
Yes, indeed. And that's where a partnership takes place, right? Between you and your patient, and you guide them and help them, and they in turn put in the part they need to put in, right, to make that effort. And that's how the best results are achieved, and transformational, as you just mentioned, in cases as well with your patients.
Yes.
I would imagine, Dr. G, that the number of sessions that are typically necessary to help your patients effectively resolve these issues would depend on each patient, his or her problem or situation or issue or issues they're dealing with, and then the appropriate customized treatment plan, as we've touched on earlier. But generally speaking, how many sessions would you say would be necessary before your patient starts seeing results to really be able to start helping them?
I cannot tell you how many times I've been asked that question. This depends on the nature and the difficulties at hand that the person is dealing with. And we have to be very mindful about that. Nonetheless, in standard practice, we could say that it takes about a handful of sessions, and from a handful of sessions to 20 sessions, let's just say, or more. Okay. I think in this case, what is truly important is that when it comes the time to deal with specific situation, you can rest assured that when you are overcoming that and you're so close to be done, we will transition into what we call a termination process. And when you finish dealing with that, then you will be done with therapy.
Now, are the results permanent, Dr. G? And again, I know that depends on each patient, the therapy or therapies and the plan that you've integrated and are helping each patient with. But again, generally speaking,
the results could be permanent. They could be permanent. And when you pass through therapy, you will learn different tools that are going to help you in the future to deal with other difficulties as well. But as I was saying, like the person that broke their leg and that received treatment and now that leg is healed, that doesn't mean that at some point that leg is not going to get broken. and that person might not need additional support. So on occasions, a person might require additional sessions just to get back on track.
And what is the risk of regression?
Well, there's some conditions like depression and anxiety that they do have some propensity to, to experience some regression. But I think that being able to consider what regression in a way would mean is thinking about our conditions. Our conditions as a person, they shift, they change consistently. And at some times, our conditions change in a way that some individuals are able to adapt. And then they don't have that much struggles.
Yeah.
On the other hand, some other individuals might just go back to their maladaptive strategies. And they might require additional support to be able to get where they were supposed to be. But it is all about our circumstances in a way. Some things might not be problematic today, but might be problematic tomorrow. And it's just a matter of just thinking, okay, where I am at and what I need to do to maintain the mental health that I have at this time.
Yes. And I would imagine something can trigger a regression, right? An event or situation or a moment we experience again.
Yeah. And even if something triggered that event, I think it's valuable that the fact that you went through therapy will help you to overcome the situation maybe a little bit faster in a sense, because you already had overcome something. So the amount of sessions that you might need might not be as many as you initially did, because now you have your toolbox is with you. You have something there. You're not starting from zero.
Now, we're literally out of time, Dr. G, but I wanted to ask you before we let you go today, if you could be kind enough to tell us about some other types of therapies that you may offer at your practice as well that can help folks out there watching.
I think as part of my training as a clinical psychologist, I do have a plethora of tools that I can offer to different individuals to address their difficulties. But just to mention a few, I do cognitive behavioral therapy, narrative perspectives, anger management approaches, which is more a psychoeducational perspective in a way. But at the end of the day, it's about the person that is going to cross through my door. And I need to be mindful of what is the situation at hand with that person and what I can do with that individual that at the end of the day is going to make it possible for them to overcome their situation, be successful, and possibly become the person that they're meant to be. And I think that just being able to bring people in and take into account their process into the life that they think they cannot have, but is actually at their reach.
Yes. And I love your community approach and focus and helping and giving back to the communities throughout the region. And I mean all communities. As you also mentioned earlier, not only do you speak fluent English as you are today, but also fluent in Spanish and sign language as well. You also teach at Gallaudet University downtown in D.C. And we're so proud of you. You are helping so many folks throughout the region. And on that note, I'd like to thank you for joining us, being a guest on our program, and educating us.
Thank you.
And we'd love to have you back on in the future.
Thank you. I'll be happy to be here.
Thank you.